It can be unsettling when flu symptoms strike, especially when a fever appears. You might wonder how high is too high, and when does it signal something more serious? A persistent high flu fever is an emergency, or warrants urgent medical attention. In adults, if it consistently rises above 103 degrees Fahrenheit, or 39.4 degrees Celsius, or if a lower fever lasts longer than 2 to 3 days without improvement. For infants under 3 months of age, any fever of 100.4 degrees Fahrenheit, or 38 degrees Celsius, or higher is considered a medical emergency and requires immediate medical evaluation. Additionally, children of any age with a fever exceeding 104 degrees Fahrenheit, or 40 degrees Celsius, should also be seen by a doctor promptly. The concern with high or persistent fevers lies in how they impact your body and the potential for complications. Very young infants have immature immune systems and can quickly become dehydrated or develop serious infections. In older children and adults, a prolonged high fever can worsen underlying health conditions, such as heart disease or asthma, and may indicate a secondary bacterial infection like pneumonia. It also strains the body, increasing the risk of dehydration and electrolyte imbalances, particularly if accompanied by vomiting or diarrhea. To manage a fever and identify when to seek help, closely monitor the temperature using a reliable thermometer and note any other worsening symptoms. Keep yourself or the sick individual hydrated by drinking plenty of fluids. If the fever reaches the emergency thresholds we just discussed, or if accompanying symptoms like shortness of breath, chest pain, confusion, severe vomiting, or bluish lips develop, contact your healthcare provider immediately or head to the nearest emergency room. Even if the fever is lower, if it persists for several days without improvement, a doctor's visit is a good idea. It is important to remember that the number on the thermometer is not the only indicator of severity. Sometimes, the overall clinical picture, meaning how sick someone appears, can be more telling than the exact fever reading. A lower fever with severe symptoms, such as significant difficulty breathing or extreme lethargy, can be more concerning than a higher fever in someone who is otherwise alert and drinking fluids. Trust your instincts and always err on the side of caution when you are worried about yourself or a loved one. Understanding these guidelines empowers you to make informed decisions during flu season, helping you know exactly when to manage symptoms at home and when to seek professional medical care to ensure the best possible health outcome.